Hi, everybody. It's John Schnorr with Coastal Fertility. I hope you are doing well. I wanted to spend a minute with you on what we call Coastal Quickies, which is just a way to give you a quick little 3-4 minute video on something that may matter and be relevant to you in the care that you provide to your patients. Today, I'm going to talk about male factor infertility. We know that male factor infertility is about a third of all cases of infertility and can be easily assessed with a simple semen analysis. Semen analysis is ideally done with 3 days worth of abstinence. Any more abstinence longer than 5 days can actually lower count and lower motility. So again, the target and goal is about 3 days. Semen analysis can be performed at any of our offices. That includes our Mount Pleasant office, our Nexton office, which is in Somerville, our Savannah office, our Myrtle Beach office, and our Columbia office, which is actually in Lexington. And so in those offices, you can schedule the semen analysis by going to www.infertilityconsult.com. Just put in the patient's name, date of birth, phone number. We will contact them, get it scheduled. The report will come back to you with a doctor signing the bottom of it, helping to interpret that semen analysis for you. When we do that interpretation, we're going to look at the ejaculate volume, which should be generally greater than 1.5 milliliters. We're going to look at sperm concentration. The World Health Organization says normal sperm concentrations are greater than 15 million sperm per milliliter. We tend to find most normal men are kind of 40 to 50 million sperm per milliliter. So I personally believe that 15 million is kind of a low number, but that's the lower end of normal based upon those criteria. The last criteria we're going to look at is the motility. That's the number of sperm moving. Generally greater than 40% of the sperm should be moving. The composite index at the bottom is called the total motile count, which is simply a multiplication of the volume times the concentration times the motility. We think the total motile count should be greater than 20 million sperm. We used to report on morphology. Morphology is the shape of the sperm. You might recall that even a normal semen analysis has, in theory, 95% of the sperm with an abnormal shape and only 5% with a normal shape. There's yet to be any real quality literature supporting morphology as a cause of infertility in and of itself, meaning that if the concentration is normal and the motility is normal with spontaneous conception, regular intercourse, there does not appear to be a direct correlation between morphology and infertility. And for those reasons, we don't even report on morphology anymore. It was confusing the situation more, and this is consistent with national guidelines. If a man did have male factor infertility, we would then initiate an evaluation. That evaluation would be a hormonal evaluation. Men's hormone levels are best measured in the morning. We typically measure a testosterone level, an FSH level, a thyroid level, and with that start to understand if there's any hormonal causes. Men with a low LH and FSH and a low testosterone level may benefit from Clomid. Most men don't benefit from Clomid or hormonal management. An anatomic assessment, generally best done by a urologist looking for a varicocele, testicular abnormalities, or sometimes vas deferens abnormalities. We generally refer to a urologist with interest in infertility. And then the chromosome or genetic evaluation for severe male factor infertility, typically done for men with less than 5 million sperm per milliliter, includes a basic karyotype and a Y chromosome microdeletion study. Of course, it's important for your male factor patients to go over their history a little bit, make sure they're not using any anabolic steroids, have any major medical illnesses, testicular injury, testicular surgery, any of those common things. We're happy to piggyback that for you and carry that down and get the testing done if you would like. So if you get testing and the sperm count's abnormal and you're just not into the male factor evaluation part of things, if you refer them to us, we can get that taken care of, get them to the appropriate urologist for that evaluation, and then counsel them with the results as to what the different treatment options are. Of course, for male factor infertility, the best treatment tends to be in vitro fertilization with ICSI, which tends to really override the male factor infertility and get pregnancy rates back to the normal female age pregnancy rates. Anyway, hope this helps you. Hope you guys are doing well and hope to see you soon. Bye-bye.